Imagine this, you are 28 weeks pregnant. You have been on your feet all day long and you have a headache that won't go away. But your next appointment is in 2 days and you just got the bill from your last one that you're still figuring out how to pay. Believe it or not, many mamas go through this not because they don't care about their health or their baby, but because the financial pressure during pregnancy is real. Doctor visit, healthy food, baby supplies, it can all add up quickly. And for some mamas, that pressure is even heavier. Today, let's talk about something that does not get discussed enough: financial stress during pregnancy. According to the US Census Bureau, Black families in the United States are about 3 times more likely to live in poverty than white families. And this affects many decisions during pregnancy. For instance, it can influence where a mama can give birth, or whether she can see a specialist or not, and how often she will attend her prenatal appointment, or even if she has a transportation to get there. Those are not small things. In fact, they shape the entire pregnancy experience. Research from Kaiser Family Foundation also shows that Black women are more likely to have not enough coverage. And that matters more than people realized. Because when a mama cannot access care early in pregnancy, guess what? Doctors may miss important warning signs. For example, high blood pressure that has not been detected yet, or a baby that is not growing as expected, and early sign of complications. Mamas who begin prenatal care later in pregnancy instead of the first trimester are more likely to face serious problems. But starting care late is not usually about not caring. Very often it is about not having access to care when it matters most. Let's talk about something that people don't mention. Mamas know that not all hospitals are the same. Some hospitals have more resources than others. So this means that more nurses available for patients, more specialists on site, more advanced equipment. Research by maternal health expert Katie Cozy-Manil found that hospitals located in most Black or lower income communities often have fewer resources available. That might mean fewer nurses per patient or fewer specialists available when complications happen. Another report from the March of Dimes in 2022 talked about something called maternity care desert. These are areas where women have very limited or sometimes no access to a hospital where they can give birth. And guess what? Millions of women in the United States live in these areas. And unfortunately, Black women are more likely to be affected by this gap. By gap here, I'm talking about quality healthcare access. Now, this is not meant to scare you. In fact, by sharing this data with you is to help you prepare, because when you understand these realities, you can ask better questions and plan ahead for your birth. For example, touring your birth center before your due date, meeting the team that may care for you, understanding where's the nearest emergency services, or writing a birth plan that reflects your needs. Because a mama who is prepared ahead of the time often feels more confident and more supported during birth. And helping you prepare like this is exactly what this series is here to do. Here is something important to understand. Most of these challenges do not happen one at a time. They often happen all at once. For example, a mama may not have enough health insurance. That created stress. Stress builds up in the body over time. Then the body has to work harder during pregnancy. Now, add something else. She may be working long hours while she's pregnant. Then add the possibility of unfair treatment in healthcare, which we talked about earlier in this series. And then add another challenge we will talk about soon, which is the difficulty to access healthy food. All these pressures can exist inside the body of one woman, a mama who is doing her absolute best with the resources that she has. So when you look at this way, the statistics about pregnancy risk start to make more sense. It is not about blaming mamas. It is about understanding the real pressures many of them face and responding with compassion. And that compassion should start with how you treat yourself. In the next part of this series, we are going to talk about real solutions and resources that can help mamas right now. But first, in part 4, we need to talk about something very, very important, which is food. Not just what you should eat, because many mamas already know the basics of healthy nutrition. Instead, we are going to talk about what happens when healthy food is hard to find where you live and how this situation can affect your pregnancy. Before you go, mama, I would love to hear from you. What has been the hardest financial challenge during your pregnancy? You can simply comment something like insurance, time of work, healthy food costs. Mama, know that your answers will help me understand what you are really facing so I can create more content that really supports you. Thank you for watching. I will see you in part 4. Bye-bye.